That was when I discovered that, Hospital A and Hospital B, although they were 10 miles apart, would charge different prices for different, for the same service. And then things started clicking.
So it was a really eye-opening experience to kind of feel like I was misaligned. Who said that? Misaligned with a partner that I thought we could really trust.
Man, we've been getting ripped off for years, and now I finally figured it out.
We've basically set it up so that people can have a no-cost health journey in probably 90% of the scenarios out of pocket. Disruption being minimal is a myth. Yeah. If you're going to do big things, you're going to have disruption, but disruption isn't always negative.
The Business of Benefits is your no BS, no sales guide to real solutions.
No gimmicks, just the truth about how to take control, transform your benefits, and care for your most valuable asset, your people.
If you're tired of the same old sales pitch and you're ready to rethink your benefits, this podcast is for you. The truth is out there. Are you ready to hear it? Hi, everybody. Thanks so much for being here. We're really excited. Thank you, ladies, for joining me today.
Welcome.
So today we're talking about redefining benefits leadership. These two ladies, if you don't already follow them on LinkedIn, please go ahead and do it. You'll learn so much. I feel like I'm the one who's privileged that I get to work with two extraordinary leaders that are truly running two of the more innovative plans that I've seen across the nation. I've had the privilege of seeing thousands of employer health plans. And again, remember, this is private sector, right? And what I find really interesting about the conversation we're going to have today, a lot of you know Steph, right? So Steph is sort of our Florida golden child of innovative health plans, I would call her. And then,
okay.
Right, you're welcome. And then Kristina is actually, like Karen said, out of Oregon, and she has multiple entities, multiple states, lots of different complexities to her health plan. And I think the really nice thing about having Kristina here today is that while we're always focused on Florida, right, and healthcare being local, there's a lot of things, problems and solutions that are being done at the national level that I think Kristina will share today that we can all take home with us. So without further ado, ladies, why don't we get started? So to start us off, can each of you introduce yourself, your name, your role, and a little bit about your company?
Sure, I'll start. So good morning, and thank you so much for joining our meeting today. We really do appreciate everyone being here, and I second all of the comments about being part of the Florida Alliance and how very important it is to be a member and really be collaborative with all the other employers because we learn so much together. So that being said, I'm Stephanie Porrino, and I work with Hendry Marine Industries. I am the Director of Human Resources. I've been with Hendry about 6 years, but I've been working in HR about 30. And Hendry Marine has 2 shipyard operations, Gulf Marine Repair and Anchor Sandblasting. We have about 300 employees and coincidentally about 300 covered lives on our healthcare plan.
And Steph has been self-funded since 2017, which is an important note.
Yes.
And I'm Kristina Ewing. I'm the Director of Health and Wellbeing at Shoestring Valley Holdings. Anderson Construction, who you saw on the slide, was one of our entities. We're in 3 states, Oregon, Washington, Idaho, also self-funded since 2017. We have about 750 active employees, a little bit of a downturn in construction for those in the business probably are feeling that this year, but average about 1,000 employees, and about half of those are on our benefits plan. Half of them are covered under a union benefits plan. I have a little bit unique background in that the first 13 or so years of my career with Shoestring, I was the financial controller. So once we went self-funded in 2017, I switched over to manage the plan from kind of the HR side. We don't call it HR in our company, but so I have the kind of unique background of starting out in finance and then moving into the benefit space, which has really served me well, obviously, as you all know, from running your own self-funded health plans.
Amazing. So, ladies, was there an aha moment for either of you where you realized like something doesn't smell right with the way that benefits are being done or healthcare in general for the employer side? And what did that look like? Steph, we'll start with you.
So my aha moment goes back to about 2016, 2017 with my previous employer. We were self-funded with one of the BUCAs, and our company had 450 employees, and we had about 600 covered lives. And despite all the actions we took to try to reduce the costs for the healthcare plan, we were self-funded, I should have mentioned that. we still got an 18% increase. But I will say throughout my career and when I got really involved more in renewal meetings and what have you, I always had those, what is that fuzzy math they're doing? Because when we were trying to understand why a certain renewal number came up, I never felt like we really had a good idea of what it was they were talking about or how they got to that number. So with that being said, going back to my previous company, we got the 18% increase, and my organization decided, without my knowledge actually, and I was the VP of HR, they had had enough of the BUCAs and wanted to explore if there were other options. And what was interesting was they did explore and found reference-based pricing. And they came back to me and said, we have this opportunity and it's going to reduce costs significantly, but it's going to require a lot of change management. And when they explained it to me, my first response was what?
No, thank you.
Hell no. I'm like, there is no way this is going to work. This sounds too good to be true. But as an HR professional and someone who was having oversight and responsibility for the healthcare plan, I wanted to understand if this were actually true, I need to see it. You have to show me in order for me to believe it. So I started jumping in, and lo and behold, that was when I discovered that, Hospital A and Hospital B, although they were 10 miles apart, would charge different prices for different, for the same service. And then things started clicking. And once that started clicking, I was like, well, if this is working for the hospital side, what is it saying on the pharmacy side? So, then I really started diving in, and then I started understanding that as a healthcare plan administrator, we had the right to essentially deconstruct our healthcare plan outside of a BUCA and reconstruct it with the TPA, the network, the PBM, and the stop loss, that we wanted to have desired outcomes, not only to benefit the company financially, but to have better health outcomes and premium stability for the employees. And that was when my journey started. So that was the aha moment, was, man, we've been getting ripped off for years, and now I finally figured it out.
Right? It's very empowering to hear that. Mm-hmm. Kristina, what about you?
There's a couple for us. So 2017 is when we went self-funded and to get our data, because you have to have your data to join a captive, which was our goal. So 2018, we joined a captive and started learning way too much, too fast, kind of drinking out of a fire hose and going, wait, do I have to do all of this today or what? So kind of digging into that and realizing there was so many things that we could or should be doing. But the first step of that was we decided to unbundle TPA pharmacy. And through that RFP process, we realized maybe we were with the wrong partner. We still felt that same kind of rush towards the finish line and ended up kind of being stuck with the only solution being in that broker's pharmacy alliance, which had their own built-in per script fill, which I was really unhappy to find out about. And it was just very last minute. Here, this is your only option. All these other people were worse options. So it was a really eye-opening experience to kind of feel like I was misaligned. Who said that? Misaligned with a partner that I thought we could really trust. And so to kind of have that feeling of being, things were snuck into the contract, I really didn't like that. And from the partner that we thought we could trust. And so if they were doing that, I kind of went, okay, everyone else is doing it. And so I needed to really make it my mission to find out where all those pieces were and get aligned with the right partners in all the aspects.
I wanted to make one other comment, because you mentioned partners. So what was interesting was, at the time when I'm referring back to my last company, we were with a broker, a trusted broker firm, again, 10 years ago. And when we went to them and said, why didn't you ever present this option of reference-based pricing to us? They said, well, we didn't think you'd be interested. So for any employer that's working with an insurance advisor or a broker that's bringing you the same options year after year with no different options or different results, you really need to check yourself first and then do an advisor switch as fast as you can.
The theme that I'm hearing here is like complete ownership, right? It was like,
absolutely. You
notice that something seems a little bit off, you dug into it, you're like, okay, well, no one else is going to figure this out. Like, I got to figure this out, yes. Right? Because you didn't have the right partners at the time. That's amazing. So I want to make sure everyone in the room understands this is And your healthcare plan should be a multi-year strategy, right? If you're stuck in that reactive renewal cycle, which we'll talk a little bit about later as well, you don't have to be. You can actually do long-term planning, and you guys are proof right here. So I want to dive a little bit deeper so that the audience understands what that strategy looked like. And Kristina, your slide's up, so let's start with you. Can you walk us through some of the changes that you made over the last few years?
Yeah, and different companies do this different ways. Some decide to jump all into reference-based pricing at the beginning. Our company decided to take a more measured approach for employee feel and buy-in. And so we took a more gradual approach, as you can see, obviously starting with self-funding and adding in the captive, and then unbundling our TPA. And then we went into things like navigation, really kind of trying to direct our members to the places we wanted them to use. Mental health is a big thing. If anyone is in construction industry, we're second in the nation for suicide and very high on the list of opioid overdose. And so those are really big things for me personally, but also for our industry. And COVID happened right around then. So that was a big piece of this and part of the consideration along the way of how we can kind of craft our health plans to be opioid friendly or non-opioid friendly, as the case may be, overdose recovery options and things like that. And then transparency, you can see we started doing some carve-outs. And then we started looking more in partnerships with vendors who we felt we were really aligned with, Color being one of the first that we started with. And we're really grateful to be one of their early adopters. And they have been such a great thought partner and really receptive to the thoughts and ideas that we had in the cancer space, and really have kind of taken those and built out an amazing program. And so we're like, who else can we do this with, right? Like that was really fun for me. I realized I've become a big nerd about stuff like this. I'm not a doctor, but I pretend to be sometimes. I feel like I know enough to be scary, right? And so then we jumped in with Regenix, which is a non-surgical MSK solution, PRP and the like, and Goldfinch, which kind of further to that mental health, is a non-opioid pain management solution. So those are really some of our first vendors that we started with. And now coming into next year, we're adding in no-cost direct primary care with a national network. Our zero-cost specialty surgery, our vendor is over here, Health Me. So thanks for being here today. And no-cost mail order pharmacy and no-cost specialty. So really diving into those no-cost solutions for our people. Currently, they're options or alternatives, we call them, no-cost alternatives. So people can still choose traditional network or these no-cost solutions, but we've basically set it up so that people can have a no-cost health journey in probably 90% of the scenarios out of pocket. And that's not usual, right? So we're really, really proud of the plan that we put together. In fact, we had an amazing meeting yesterday with our brokers and all of our partners coming together to figure out how they can work with one another when they refer back to each other, so that our people don't feel like it's disjointed. Because as you start doing this, you kind of realize, okay, there's some little cracks here in how the member experience is going to be, and you want that to be really seamless. And so we had a really amazing planning session yesterday, getting ready for these additional changes in 26, and we're just really excited about the offerings to come.
So you said cracks, and I want to dig a little bit deeper into that. What challenges did you face during this evolution?
Certainly member education. There's even coming into this year, but I think I've earned a lot of trust with our members over the years. They've seen how we've been able to keep our premiums relatively flat for most of the years that we've been doing this, and the essentially free healthcare. But there is still that effect that people have. They think more is better, and pricing that's higher is better care. And I think we've all experienced that with our members to some degree. And then there's the spouses, especially in our industry. Construction's predominantly a male industry, and not every household, but a lot of households, the spouse is the decision maker when it comes to a lot of financial decisions, including healthcare. So we early on targeted our spouses. We bring them into the orientation process. We send communications directly to them. I meet with them as often as they want. I tell the employees all the time, don't do the telephone game. You're going to get it wrong when you tell them, just have them call me. And that's a little bit selfish on my part, but I've also built those relationships with the spouses through that. and really kind of cut out that middleman. And now they come to me. I probably get as many emails from spouses as I do
Same.
employees.
Mhm.
And that's something that I'm really proud of, but also it helps get these things into play because they're the ones that are going to decide if they're going to use direct primary or our specialty solutions.
Yeah. Thanks, Kristina. That was awesome. So we're gonna go into what the program looks like today, and then we'll switch over to Hendry Marine. So actually, this is a perfect time to elaborate a little bit on what you were talking about yesterday. So yesterday, we hosted a vendor summit. As you can see, Shoestring Valley Holdings has quite a few vendors. Between the people who showed up in person and virtual, I think we had, 25 support people on a call all day long planning how are we going to make this the perfect experience. And obviously nothing's perfect, but as seamless as possible for members, right? And then what we also did was we set KPIs, so key performance indicators for every single vendor. So when we meet on a quarterly basis doing our fiduciary quarterly meetings per ERISA's compliance, we can say, and we can actually monitor the vendor performance. We can say, more than do we like them, right? A lot of the times healthcare is so opaque. It's like, well, I love my PBM, I love my TPA, I love my broker. That's not enough with ERISA fiduciary duty. We really need data, we need performance, we need monitoring. So that's the part I was excited about was the KPIs. But do you want to add anything or is anything that you're specifically proud of with the program today that you think is unique?
Yeah, well, I mean, it was interesting with the KPIs, right? Like we had planned to do that, but kind of bringing up the topic, they all set them for themselves. And I was like, great, I didn't have to assign any of these. So it was really nice, like having that conversation. And at the end, they kind of all got it. And they're like, okay, this is what they need from us. And they listed them all out and I didn't have to add anything. I was like, this is perfect because I didn't assign them. They thought of them themselves. Right. But the whole point is that they're each individual experts in what they do, and they recognize that. And so really this was about how do our employees navigate through this complicated system, or hopefully not complicated system, right? Behind the scenes, I don't care. Complicated, I can handle. But I want it to be really seamless for our members. And so how does that look like when a member engages? What if they need to transfer between the two? What does that handoff experience look like? And so we really wanted it to be a really natural experience, but also knowing when they kind of are at their limit of service, who's the next person that they engage and how does that engagement look like? And it goes both ways between all the vendors. So really setting up kind of that web of connectivity was what yesterday was about, and it was just it was everything we needed it to be.
Something that I really loved was a lot of the KPIs, the initial kind of reaction, the gut reaction is, well, savings, right? Like that's how we're going to know we did a great job is savings. And it's like, yes, absolutely. But what's really interesting is when you have more of a complex, innovative plan and there's a lot of moving pieces, collaboration is equally as important as savings. Being willing to pick up the phone and call another vendor and say, hey, I know this is case management, we have color, we've got this oncology situation, like what should we do here, right? As opposed to just steamrolling through something. So I thought that was pretty cool that, the collaboration aspect has been really cool to see. All right, Steph, we're gonna come back to results on Shoestring here in a sec. Let's switch gears to what Hendry Marine did, because it was a little bit different.
Yeah, we had a little bit of a different roadmap, but I came to Hendry Marine in December of 19, so almost 6 years ago. And when I started, the 2 years prior, they were with a BUCA, fully funded, and it got to the point where the increases were unsustainable. Now, we're a privately held shipyard, again, 300 employees, 80% male. And what happened was the broker at the time decided that, okay, it was time to try self-funded with the BUCA. And despite that effort, they still got increases, again, that were unsustainable. So midway through a plan year, actually switched to reference-based pricing. Wow. What was interesting was when I first got there, they switched to a reference-based pricing model with Imagine 360, but kept the CVS Caremark PBM.
Womp, womp, womp.
Want, want. Yeah, speaking of tiering, I want to talk to Cora about that too. But that being said, we went down that road of RBP, and I get there in December 19, and the horse is out of the barn. It's December, so 2020 plans are done. They're doing open enrollment. So I'm like, all right, I'm going to take over this plan, and I've got to really start digging into the data. And fortunately, because of the arrangement, we have with our RBP vendor, we're able to see all the data. We didn't have data on the pharmacy side or enough to make any informed decisions, but being that we were with, CVS Caremark, I already knew that we were overpaying for our pharmacy spend. There was no doubt in my mind. So come 2021, we did a couple things. The first thing was we got rid of CVS Caremark and we brought in an independent PBM. Off the bat, we saved 30% on our pharmacy spend. And our pharmacy spend has been, I think the national average is somewhere between 25 and 30%. Ours is around maybe 10 to 12%. And what was interesting was, through that transition, we were also getting more data. Because now we're getting pharmacy data, we're getting, our claims data, and mid-year in 21, we were having a mid-year review, and I'm looking at the data and I'm going, oh my goodness, only 15% of our employees or members are going for their preventative wellness exam. So to me, that translates to we have 80% men, only 15% are using their preventative wellness benefit. We are going to have a catastrophe on our hands. Average age 47 in the shipyard, that's also important. So right away I was like, we need to take immediate action. We already know the employees are not going to go for their preventative wellness exam, so we need to find a solution. So the following month, I am at a conference, and some of you might have heard me tell this story before, but it's so compelling as to why it's important to offer access for care. So we end up, I met Chris, I think Chris is over there, Chris Yarn from Walk-On Clinic, and I looked at that Walk-On Clinic, the mobile primary care unit, and I said, that's what we need in the shipyard. Because again, knowing who your members are, meeting your employees where they're at and understanding is extremely important, along with knowing the data. So we brought the Walk-On Clinic on site by January of 22. And what was interesting was originally our thought was, let's do preventative care and let's roll this out and see what happens. And what was interesting was the one thing I did not consider in that process was if people were going to come to the clinic. And nobody wanted to come because they didn't want the company to know anything about their medical information. They were not disconnecting that story. So I'm like, all right, we need to do something. So I'm literally making this up as I'm going along. And I said, we need to do something and get people into the clinic. And I said, all right, we're going to host a contest. Between January and April, anybody who goes for their preventative wellness exam is going to be put in a drawing for 5 days of PTO. There would be one winner. Literally made it up as I went along, and then asked for forgiveness later for the time off I was giving away. So that being said, so the people are now going in. And what happened next was the most amazing and miraculous thing. So one of my employees goes in to win PTO, and the doctor on site says, did you know you had a lump in your neck? So he had stage 4 cancer. He had no idea. Had we not brought that clinic there, he probably would not still be with us today. Another employee goes in and he has blood sugar so high he's almost at stroke level. So organically, people started going because they were telling their colleagues how amazing this benefit was for the employees and their family members. But again, it was all very intentional. It doesn't cost them anything. They go on company time. They don't have to take time off. But that was a huge piece of our story starting in 2022. So we switched out the PBM. We brought a primary care clinic on site. We originally started with the clinic being on site 1 day a week, switched to 2 days a week a couple Julys ago because we realized there was utilization and a need. You have to meet the employees where they're at and meet the needs. So part of the independent PBM solution is also making sure you can offer international pharmacy, specialty, and alternate funding for medications. That's how your costs are reduced, in addition to just paying, a decent cost for your pharmacy spend. On-spot dermatology, another huge win for us. Again, bringing people on site to help your employees. Regenex for MSK, we have a lot more utilization than we did originally, and I'm very pleased about that. And in October of 25, we were very, very thrilled to start working with Ethos. So they're our new advisor. And next year we're offering $0 costs for imaging, because to Cora's point, like understanding where your claim costs are and your spend. Definitely imaging is one for us because people are doing them in the hospitals. We need to get them out of the hospital and into ambulatory surgery centers and imaging centers. And then steering employees, with very motivating copays, which are basically zero or very low cost, to get them to think differently about their health care. So the plan is different next year, and we're really excited.
You ladies are amazing. Every time I hear these stories, I'm like, this is incredible. So let's talk results, right? Obviously, it's a multi-year strategy. You have good years, you have okay years. Kristina's actually had a lot of good years, so let's talk about that.
Yeah.
Do you want to walk us through, Kristina, some of the financial performance and just some of the what you consider the wins, I guess, and everybody can read the other ones up there.
Yeah, it was kind of fun to do. I think, 10 years in, we had only premium increases 2 of the 10 years. And so flat premiums for employees is such a gift when everything else is going through the roof. And so on average, an employee over that period of time has saved $33,000 in premiums. And that's just what's coming out of their paycheck. That doesn't account the fact that we've increased and lowered the cost of care. So double whammy there for employees. And then the company, we've realized almost an $11 million savings, which our plan total is between 5 to 7 million per year. So it's like $1 million per year. In those ratios is pretty good ratio, right? And then, rebates through the pharmacy, international, all these different things that we've done, direct primary care and our no-cost specialty coming up. So no-cost specialty does include imaging, it includes surgery, it includes basically anything you can schedule that's not emergency, right? So we're really layering in all these no-cost alternatives that, for employees, it's just so important. With everything else just skyrocketing, it's the one thing that we can help control for them, and I've kind of made it my personal mission to try to not increase premiums ever. And so the 2 years that we did was, it was just like I hated it, every second of it. So I'm hoping next year that we can get enough buy-in to these optional programs that we can offer no cost and maybe even lower premium for next year. So yeah.
Awesome. Thank you for sharing that. Steph, let's talk a little bit about what the program looks like today. And I think you touched on quite a bit of this. Are there any programs that you're especially excited about, like newer ones?
Well, I'm excited that we are offering ambulatory surgery centers at a very low copayment, again, to make our members, think differently about approaching healthcare. And even my mind shifted 2 to 3 years ago. I used to be a fan of high deductible healthcare plans and the consumerism whole, program that used to be out. And now my mind has completely flipped, because when you think about, a healthcare plan, you want employees to be able to access it. And when the deductible is too high, I call it functionally uninsured, because they're not going to go. They can't afford the deductible. So you give them areas of the healthcare plan that mean something, that are going to give them outcomes that they need. So, working with you guys, we're taking different approaches this year than we had.
Something else that we've been focused on with both clients is how else can we reduce risk, right? Because so when you think about insurance, it's literally just a transfer of risk, especially when you're working with the BUCA. You're selling your risk to a carrier, mm-hmm. right? There's other things that can be done to avoid, reduce, and retain a healthy amount of risk, right, through stop loss. So Steph, something that I know we were trying out this year was a reduction technique on the spousal side, because claims with spouses were higher. Do you want to talk about that at all? Helia?
Oh, yes. So one of the things that we're looking at, because, I want to touch on oncology for a second, and something that we're really challenged with, because we have a couple of our spouses that are covered on the plan. And one in particular, has been our high dollar claimant, the winner of the high dollar claimant prize for 2 years in a row. And, we've had significant costs to our plan, and it's related to oncology. And it's because the physician, and I'm getting to the point, sorry. The physician, this is the point of taking control of the plan, because it's possible. Yes. The physician that she's treating with at this particular hospital gives us a hard time. And we've tried to, reduce the risk and, change the care plan and what have you. And he kept saying no. And I said, well, we need to do something. So talking with Ethos and, thinking through what we can do. And the other thing we're doing next year is we're having a different approach to oncology. And it's not to say they can't go to who they want to, but, it's going to have to be medically necessary because infusions can be done at an infusion center. They can even be done at home. So those itself would mitigate that risk and reduce it significantly. But Helia is a program to encourage the employees to, if they have a spouse that has a health care plan that they can jump on, our company was going to fund an HRA for $8,000 for them to move over to their spouse's plan. But they had to have been on our plan and on 2025. So that's a way to reduce some of that spend that we were seeing. So I'm looking forward to the outcome.
Because the thought process, for if it's not clear enough, is that each individual in your plan, there's a spec, right? Like whatever it is, 50,000, 75,000, 95,000. There's a liability with that member. Funding an HRA at $8,000 versus a potential spec hit of 95 makes a ton of sense, especially when they're your high cost claimant. So that was something that was kind of interesting. So Steph, let's talk results for you. Walk us through what you're most proud of here on the results slide.
Well, the financial performance, certainly. I mean, going with an RBP vendor, and one of the things Chelsea knows I love to say is, choose your hard. That's something I always say because it was hard to tell my employees their premiums were going up, but the plan design was getting worse. Or is it, is the hard getting through that change management process and offering something better on the other side? So our 5-year build charges, we have saved, $59 million on our build charges since we went with our reference-based pricing provider. We've certainly, been optimizing our PBM relationship, going with international and, pass-throughs to the plan. The international pharmacy at zero cost to the member for a 90-day fill. So it's certainly something that will incentivize someone to make that change. Assuming you're working with the right vendor partner and they make that change, seamless for the member. The on-site primary care, and in fact, in 2026, our relationship with Walk-On Clinic is enhancing even more. They're offering a new analytics platform that's doing even a deeper dive into our claims history and giving us predictive health outcomes that we can then share with the members and make sure that we're taking care of them and there's that continuity of care. So that's huge. And the plan upgrades that we're offering, the $0 copay for the imaging, $0 mental health, $0 mental health, because you're right. I mean, it is a problem. And not only do we see it in our claims, we see it on our pharmacy spend as one of the highest costs on our plan. So there's definitely correlations that you can connect between the two. And certainly, rewarding our employees for making in-network choices for some of these vendors, and incentivizing them to behave differently with the healthcare plan. So a lot of different things.
Yeah. So I'm curious for everyone in the room, is this inspiring to see, it's possible 1 year at a time we can take a baby step, right? And I think Cora said it really well. Whatever that first step is, it's different for everybody. But I think it's super inspiring to see that, there is a planning element to this. It doesn't have to be reactive. We're going to switch gears a little bit to compliance, everybody's favorite topic. Please don't fall asleep yet. We got a few more minutes here. But I think this will actually be a pretty good compliance conversation because the way that we approach compliance is it's not just check the box. It's how can we actually leverage this to get the data that was talked about this morning that somebody's telling you that you don't have when you do, right? So let's talk through specifically ERISA, fiduciary responsibility, maybe some CAA. Did you ladies ever experience that sort of well, you actually alluded to it a couple times, that typical renewal process where it's you're up against the wall, it's a lack of transparency. How did you break out of that cycle, and did the compensation disclosures for the CAA help you? Did the gag clause attestations help you get what you needed, or did you just push really hard?
Yeah, I would say we did have to push really hard. We had just recently gone through a broker RFP, someone we thought was really aligned and said all the right things. And yeah, we believe in your vision. We're going to back you. And then very quickly just kind of pumped the brakes on us. And then there was a few, we call them misalignments that we found as well with the new partnership. And so that's how we ended up finding Ethos. We had kind of brought them alongside as kind of a secondary little bit of a watchdog support. And then when we realized the original partnership wasn't salvageable, they were so amazing in letting us switch over kind of midstream as we were halfway through this crazy 26 planning and really jumped in with both feet. But I think the other thing that's really nice, we're pretty lean in my company. I am a department of one doing all of this. I have one other person who does a little bit of like invoice and stuff like that, but he only works 1 day a week. So,
so she doesn't have anybody else helping her.
And so for one of the big things for me, I really don't like the compliance pieces. Yeah. So Ethos does have a really great compliance fiduciary kind of package that brings that all alongside. And so I don't have to think about it, right? And I think that's a really good conversation to have with whoever your broker partner is like, what are these things? You know, we all have to do them. What are they doing in that way? And can they check more of those boxes for you and tie that up in a nice little package so that you don't have to think about it? Obviously, you want to inspect what you expect. You have to look at it still, but to not have to be the one doing it all is so nice. And so, you know, I just encourage you to talk to your own partners and see if that's things that you can encourage them to take a little more ownership of as part of their roles.
Steph, do you have any comments on that?
Yeah, I mean, I second everything you're saying because, you know, we had a broker partner for a long time. And, you know, I did start to question when I got to know a lot of other folks in this space, you know, we want to work with the best of the best. And in our opinion, it was Ethos. And that's why we made the switch this year, because you offer the co-fiduciary relationship. You're standing behind us and, you know, offering us support that we didn't have before. So we're seeing a different level of fiduciary responsibility and compliance than we had before. And you guys are keeping us in check.
Let's talk about procurement, right? Because all these relationships, like you kind of alluded to it, like a lot of the times maybe a vendor will say the right things in an RFP process and everything kind of looks good. And then when the rubber hits the road, it's like, oh, this isn't actually going the way that I thought it was going to be. Or at dinner last night, I heard multiple conversations around, well, I brought the idea of a fiduciary PBM to my team and they said no. And when that happens, right? So let's back up to the way that we find our vendor partners is usually through a procurement process of some kind, right? Whether it's a formal RFP process or otherwise. What types of questions have you learned that maybe the employers in the audience could gain insight from that you can ask before you hire somebody so that we're not having these situations on the back end? Any ideas on the questions there?
Well, my first one isn't really a question, but it's also just to say, like, I don't just wait for my partner, whoever my broker partner is, to bring the solutions to me. I am a researcher, but one of my tips, I kind of alluded this dinner last night, is like, if you're going to a conference like this one, check out who the sponsors are and who's attending. Those are people that are already aligned with you. So when you're going to do an RFP, these are people that are contributing to the spaces that you want to be a part of. And that for me has always been like kind of my first step. If I'm going to a conference and I really like the content, I'm looking at the people that are attending who aren't me. And I'm seeing what do they do, and I'm making notes. I'm keeping kind of these logs, essentially, of vendors that I want to eventually look at someday. So I don't rely strictly on who my vendor or my broker partner brings to the table. And so for me, that is also a bit of a fiduciary process, but also kind of a gut check of making sure that they're in alignment with my needs and wants out of the vendors.
Mm-hmm. Yeah, I couldn't agree more with what Kristina's saying. So I've been fortunate enough the past 3 years to travel all over the country and speak at different conferences and share the Hendry story and share, you know, the stuff we shared today. And I've met a lot of vendor partners, and I do something similar where if it's something, you know, it's a vendor that I think can really impact our healthcare plan and have better outcomes for the employees, you know, we're willing to try something. You know, if it's something that doesn't align with what our plan is and what we expect, then that's not a partner we want to work with. So it's also important that we set the expectations that, just like we were talking about earlier, the vendor partners that we have must work together as one healthcare ecosystem. everybody's connected, everybody knows who everybody is. So in case we need something, there's an expectation that they would work together. So we're setting the expectations, we're setting the demands, we're the customer, we're the ones that are paying. And, if we need help, then, we ask, but you guys have also brought a lot of great value to the table with vendors.
So for the private employers in the room that are subject to ERISA, right, having a fiduciary process is really important. How am I using due diligence? How am I being prudent in my decision making? Am I documenting the decisions that I'm making? And hopefully you have partners that are helping you do that, right? Some of the questions that I think you could ask, and I'd love to hear your ladies' opinions on these, that can tell a lot really quickly would be, number one, how and when are you paid, right? Number two, do you have conflicts of interest with any of the other vendors? I saw a compensation disclosure last week where it literally outlined that the carrier that was recommended and has been in place for 10 years, that brokerage was receiving loans and lines of credit from that carrier. Right, weird, right?
So read the contracts.
Read the contracts. No, we're not playing that game. But contract language, right?
I don't care.
Asking, can I get a sample contract to review before I enter into an agreement with you? Do you take co-fiduciary status? What is your fiduciary process? Do you have cyber insurance? Like, there's so many questions, not to mention, we're talking about data. When you start building a plan like this, data's flowing in a lot of different directions. Yeah. How are things integrating? Who's paying for these integrations? How long do they take? What are the KPIs? So those are just a list of a few questions that I think sometimes it's not just what's going to save me money. Right? Do you have anything to add?
No, I mean, it is important. Yes, it's important to save money, but if the process of the transition or the support is going to be painful, it's not worth it. Yeah. Because somebody's going to be spending more time on something they shouldn't, because you have an expectation that you're paying someone to do it. So set that expectation up front.
Yeah, and one thing, like KPIs is nothing new, but putting them in the contract has never been done until I started with Ethos. And I was like, what a simple concept, right? Like putting it in the contract, what we're asking them to do, so that if they go, oh, well, we didn't do that. What do you do about that? It's not in the contract. And it seems so simple, like, duh, why didn't I think of that before? But yeah, I think that was a kind of an aha moment for us going through this last round of contracting with you all.
Right. So both of you have a quarterly fiduciary process, you have committees, you've established all of this.
Now we do.
Now you do, yes, and that's amazing. So do you have any advice for members of the audience that maybe they're just getting started on figuring out the fiduciary governance and what that looks like, and anything you'd let them know?
I guess first and foremost, it's the acknowledgement that we as plan administrators are plan fiduciaries, like it or not, and you don't want to wait for something to happen or a lawsuit to get filed to be reactive. So I think being proactive and creating, these fiduciary committees and taking the notes and doing all those things is extremely important. It's not that would be nice. It's a requirement.
Yeah, and I think for me, because I do have a kind of a diverse background, I did so much of this almost in a bubble. And so while I don't need the CFO to come and do the financials for me, I can do that myself. I'm designing the plan. It was kind of a reminder to be like, you still need people like looking over this as kind of a fiduciary double check. And so bringing them back into the conversations a little bit more, instead of the few times I had been meeting with them, including our in-house counsel. Our CEO has always been really involved, but adding a few more people back into the process on a routine basis is also a protection for me as a plan fiduciary. And so that was just a good reminder of that piece of it. Even though I can do all these things and I don't need that person's help, I should still have their input and allow them the opportunity to poke holes and ask questions so that it's fully double checked.
So the point of this conversation today was to talk about and hopefully inspire everybody in the audience to see, if you aren't already trying to do these things or taking steps in the direction, you can, and it can be strategic and it can be over multiple years. But we've also talked about how sometimes there's a little bit of, there's ideas and then there's implementation. And those are two very different things. Yeah. Karen sent out a survey to a lot of you in the room, and hopefully, I think quite a few of you answered. And the question was basically that: what does it take for your organization to move from ideas to actual implementation? And these were the two top responses. Disruption must be minimal. Administrative burden must be minimal. Can you ladies comment on either of those?
Disruption being minimal is a myth.
Yeah.
If you're going to do big things, you're going to have disruption, but disruption isn't always negative.
Right.
And so disruption in itself is inherently framed as a negative, but there's really good disruption. In fact, most of what we do is really good disruption. So it's all about how you frame it. It's all about how you educate it. It's all about you talk to it with your employee base and their spouses. And so, or partners, right? Like that's the big piece of it is how you frame these changes and decisions that we're making. It's not necessarily the disruption. It's the D word, right? It's a bad word.
Like the F word.
Yeah,
The F word,
exactly.
yeah.
We've learned a couple bad words today.
Yeah.
Any comments, Steph?
No, I think that, you as HR professionals, we control the narrative. We control what is told and how it's told. And it's very important to get buy-in from the top down, because if your leadership team is not in alignment with the changes that you're going to make, it's very likely to fail, because there's going to be someone disrupting the messaging we're trying to send. So I think that's extremely important in, the grand scheme of things, but also to be a valuable business partner. It's to show why, why we need to do this. And, the employees would understand that.
What was the second one? Once I heard disruption, I went, ugh.
Yeah, I know. Yeah.
Administrative burden must be minimal.
Administrative burden. Sure, but you have the right partners in place. You should hopefully have the right partners in place to make that piece more manageable.
Right.
And if you don't, that's a relationship maybe you should look at. Like these things are hard to do, but you hire experts and you contract with experts to do these things for you. So administratively, it shouldn't be that big of a lift if you got the right partners in place.
And you choose your hard. Do you want to pass
Yeah.
along 20%, or do we want to vet vendors every year, right? Or whatever.
Yeah.
Yeah. Okay. So I want to thank you two ladies so much. Thank you for being
Welcome.
leaders and pioneers. Thank you for sharing your story. And we're going to open it up for Q&A. Oh, all right.
Sure. Hi, I'm Harry Travis. I am a recovering pharmacist and PBM executive. I have 2 support groups I have to meet with on a regular basis. Tell me about your international pharmacy program.
Do you have international pharmacy?
We do.
Yeah, we both do. Yeah, go ahead.
So actually, it's embedded into our relationship with our PBM. So the nice thing is that if a claim is submitted through retail by a member, it gets flagged in the system, and then they automatically reach out. So there's a connection. Again, it's seamless. So, then we see that, the member will be notified that they can get the prescription at no cost, and it has to be voluntary. So, that's one thing that is still a challenge, but it's communication. But we have seen a reduction in our spend with our new PBM as of 2025, because we did switch, because we were shifting some of the costs internationally. We saw a huge reduction again.
And I think it's important to note that, I shouldn't say all of them, the ones that I know of that do specialty pharmacy internationally are other tier 1 countries. And so tier 1 means it's the same criteria that we have in the United States. And in fact, it's a lot of times the same exact facility that makes the medication that we use here in the United States. Yep. So the crazy part is it's the exact same thing. It literally is the exact same thing in a lot of cases. They're just marking it up exponentially when it gets to the United States. And so this process essentially circumvents the middleman, the PBM in this scenario, and that's how you save the money.
Yep. All right.
Hello, I'm Chris Yarn. I'm a recovering property casualty broker and health insurance agent. So I started an on-site direct primary care company a couple of years ago. My question is actually kind of for all of you, Chelsea and Stephanie, maybe different perspectives on it. What do you see as more important kind of at the C-suite level of your employer groups that you all are part of and communicate with in terms of when you do these strategies? Is it more about reduced disruption, right? So, primary care practice helping employees navigate the rest of the health plan ecosystem, knowing all of those solutions like you talked about? Or is it more important for that C-suite to see the data on what's actually providing return on investment?
Well, I think you know me well enough to know I'm always looking at data, and I always want to know that the money that we are investing, that the company is paying for, there is an ROI every year, and we're also increasing utilization at the clinic, because that means the employees are getting the care they need, there's continuity care, and they're being taken care of. And we've seen that year after year.
So for my perspective, it's very organization dependent. There's another client here in the audience where their CEO overnight decided we're going reference-based pricing. We're doing from a Blue Cross Blue Shield plan, right? Like we're diving all the way in, and that was CEO driven. There wasn't, I mean, yes, of course there were savings. Were they substantial over? Yeah, they were okay, but they weren't anything to, get crazy about in terms of ROI. It was a mission values driven decision at the C-suite. However, I have a lot of other clients where it's very financial, and it's really the CFO that's like, if we don't see a return this year, we're not doing it. I think there's something to be said for direct primary care, for example. It's quite an investment, right? It's somewhere between $75, sometimes over $100 per member per month, whoever's enrolled in it. If you're not getting a savings that year, positioning a direct primary care program to an employer can be kind of tricky, right? However, when you look at the downstream impacts, lower ER visits, 30% first year, almost guaranteed every single time, right? Or the Onsite clinic like Chris has, those things, the value and the ROI is coming. So it becomes a question then of, can we see past this financial year? Can we see past that annual premium number? I would say it's 50-50, Chris. Half of the organizations can, half of them are still stuck. And actually that was one of the questions Karen sent out, was what's the reason that you don't make change? And it was like, we need 100% guaranteed savings. Sometimes that's really hard to do first year. Sometimes it's not. But I'm telling you, if you walk this path, it's coming and it's consistent. And that's the piece. It's sustainable, right?
I was going to say, not to mention from a recruiting and retention standpoint, what a story you can tell to those people that come to work for your company, and then they're referring other people in because of what you offer, as a total benefit package. So just be mindful of that as well.
I would say ours is the opposite, though. Ours is very service-driven, and our C-suite is very much focused on the employee experience, and I kind of have to really push to get these other ideas through with kind of guarantees of like, I'm going to make this easy for people, right? So it has been a little bit different for us than it has been. I've had to do a lot of selling to the C-suite, and maybe.
Well, thank you so much.
Thanks for
so
having
many great ideas coming out.